This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
In today's Family Matters, we explore the health impact of wildfire smoke. Last year's fires pushed Portland to the top of the list of most polluted air on the planet. And with the upcoming fire season, we want to learn more about how air quality can affect our health. Here to share more, we welcome from Providence Medical Group, Dr. Andrew Singh. Good morning, doctor. Good to have you with us this morning. I'm looking back and thinking back to that time last year. We were just dealing with COVID, and then the wildfires hit. It was crazy.
Absolutely. It was a very difficult time for many Oregonians. The pandemic and the wildfires on top of it really added to a lot of respiratory problems that people were having.
So tell me about the issues that your parents were, your patients were suffering with.
So I don't want to talk too much about specific patients, but I
Sure.
do take people who work outdoors, and we had quite a few individuals that had to come to see us for the classic problems of smoke inhalation. So typically what people experience, wildfire smoke is made up of many gases as well as particulate matter. And these gases can be irritating to the eyes, the nose, the back of the throat. But what we really worry about is particulate matter getting deep down inside the lungs.
How long do the effects of smoke inhalation typically last?
Generally, the acute effects with irritation of the eyes and nose, and then perhaps some coughing, maybe even chest tightness or wheezing, generally last less than 1 day from an acute event. But we do know there can be cumulative effects of wildfire smoke over time.
Wow, so how do you treat them?
It depends on what people are feeling. So if their symptoms are relatively mild, it's avoiding the exposure to wildfire smoke. So trying to get out of the area.
Sure.
If it's quite significant, we ask people to come in to either their family doctor, their PCP, an urgent care, or perhaps even the emergency room, depending on the extent of their problems. We do have ways to diagnose how severe the problems are with either breathing tests or imaging like x-rays or CT scans, but treatment generally is inhalers to enhance the breathing apparatus that we have.
So if the damage you get is scarring on your lungs, how does that affect someone's long-term health?
So we don't have great studies about the long-term effects of wildfire smoke on individuals. Probably the best comes from firefighters that are actually out in the wildfire smoke trying to combat the fires. And we do know that long-term health effects, people do suffer. Firefighters have an increased rate of lung cancer compared to controlled subjects that don't work in wildfire smoke. So there are cumulative long-term health effects that could end up into being cancer in the lung.
Wow. So if we have wildfires in our future, what do you suggest that we do?
Well, for individuals, if you can, sheltering at home is the best. If it's safe for you to be doing that, where you try to cut off all ventilation from the outside. You don't want to be cooking. You don't want to be lighting any kind of candles or vacuuming, doing things that can raise dust into the home. So sheltering in place, if you can, that is the best thing to do during an event like this.
What about the masks that we wear to prevent COVID? Would that help at all if we had to go outside?
That's a great question. In fact, no, the kind of dust masks or surgical masks that people are wearing for COVID-19 do not protect us from wildfire smoke.
Oh.
The particulate matter is very fine, less than 2.5 microns in diameter. And that particular matter can actually get around the mask that we use for COVID and get deep down into the lungs.
So is there a mask, though? Because firefighters wear those masks. There's a certain type of mask that they
firefighters
wear.
have very specialized protective equipment. They actually have SCBA type of stuff with the air, kind of pack on their back. But for general use, this is a little tricky, so I want to try to explain it quite well. So N95 respirators, which actually have a tight seal around your face, are the protective equipment that should be used during wildfires, because it will actually filter out over 95% of that particulate matter. But we do know that wearing an N95 mask puts extra load on the cardiovascular and the pulmonary system of the body. So these are not just benign things that we ask everybody to wear whenever they're going to be outside, because there are health effects just from simply wearing these respirators.
Wow, fascinating. Doctor, thank you so much. I appreciate it.
You bet. Thank you.
Of course, we'll put all the information on our website at KATU.com. Go to our Family Matters page to find out more. And we'll be right back with more AM North. Oh, I apologize. To learn more about reducing human-caused wildfires and the impact on your health, head to the Family Matters page at KATU.com. You can also learn more about the future of fighting wildfires, creating fireproof communities, and the fire forecast by watching our live hour-long special event, that's States of Emergency Wildfire Threat. That is tonight at 7 o'clock right here on KATU. Dr. Singh, thank you. We'll be right back.